Let's talk now about the Patient Protection and Affordable Care Act, which was a bill that was passed into law on March 23rd, 2010. Now, I'm recording this in November of 2013, and I think it's important to say that because things are likely to change, and so as of this date, this is where we are. So here's a picture of a bill. Actually, this is not quite accurate. There we go, that's better. And the reason why I made him a little bit chubbier is because this bill is huge. It's 906 pages long. And as we discuss the details of it, you'll see why it's so big. It's actually quite amazing that this thing got passed, considering that many before have tried to pass health care reform and many have failed. People from Nixon to Carter to Clinton. The last health care reform that we had passed was by Lyndon Baines Johnson in 1965, and that was the Medicare bill. And so what President Obama did was, realizing how difficult it would be to pass health care reform because of there being so many vested interests, he issued a bunch of guidelines to Congress and had Congress create the bill with the help of all those third parties. So there are a lot of pieces to this, and that's why the thing is huge. Now, what the Affordable Care Act aims to do is really three things: increase quality, increase coverage, and so that includes decreasing the amount of uninsured, but it also means increase the number of things that are covered, as well as decreasing costs. So these are some pretty broad-reaching goals, again, and that adds to the fact that this bill is so huge. So what I wanted to do in this first video is look at each of the components of the Affordable Care Act. And first, let's get an overview. And the first thing that we'll look at are the consumer protections that were advertised so heavily. And these are the things such as the fact that you can no longer be denied insurance because of a pre-existing condition, that there are no more lifetime limits that you can get from the insurance companies. They're not going to drop you when they think that you're too expensive, and the fact that people were discriminated against in buying insurance. So all of these protections were built into the plan to protect people against insurance practices that led to people going bankrupt, because nobody really knew what their insurance plans were going to pay for and what it wasn't, and at some point you could be dropped. And so then this led to number one reason for people becoming bankrupt is that their insurance, they had health care bills and their insurance wasn't paying for it. And the next thing that we should talk about are the mandates. This is the next thing that's been getting a lot of news. And there are really two kinds of mandates with this law. There's the individual mandate and there's the employer mandate. The individual mandate says that people have to have insurance, and if their company doesn't provide it to them, or they're not on Medicaid or Medicare, or they're not in jail, then they need to buy it. And if they don't buy it, they refuse to buy it, they're going to pay a penalty. That actually went to the Supreme Court, whether the government could do that or not, force people to buy things. The other mandate is the employer mandate, and that says that companies that have 50 or more employees, they need to supply insurance to their employees. Now, this individual mandate is set to go into effect in 2014, and so was the employer mandate. But companies said, no, we are nowhere near ready, and so this was pushed back to 2015. Another component of the Affordable Care Act is the Medicaid expansion. And what that means is Medicaid is that state-run program, meaning states pay for this to ensure they're poor people. And this expansion says you need to include more people in this. So this is going to eventually cost states a little bit more money. Now, for the people who can't afford insurance, they're going to be given subsidies. And so this is Uncle Sam here giving out some money. And subsidies are also going to be given to the small businesses. Remember, it was big businesses that were required to buy insurance. But for the smaller businesses, those less than 50 employees, if they buy insurance, they're going to get a tax credit. So that's some incentive for them to buy insurance. So now this is going to cost more money. And so this is one of the things that people are worried about, that it'll increase costs. And the final component that we'll look at are the healthcare exchanges, and this is something that's been getting news of late. These are the state-run marketplaces for people to buy insurance, and the insurance has to be structured in a way that it's easy for people to compare. So they're comparing apples to apples and oranges to oranges. The way things are right now, you have to go to an individual insurance company, and their plans are fairly complicated, and people oftentimes have no idea what they're buying. These insurance exchanges hope to make that easier. So these are the 5 components of the Affordable Care Act that we're going to look at: consumer protections, mandates, subsidies, Medicaid expansion, and exchanges. We'll look at each one of these in further detail. And I wanted to acknowledge Dr. Saparna Dutta, who gave a Grand Rounds talk from which parts of this presentation are taken from, because she did a great job with it.